Case study presentation.
Here we have patient AT, who is 51, who is a Mason and lives in Kingston and is single but is in a relationship. His presenting complaint was that of a swollen and painful sac which he has been experiencing for 1 day. This 51-year-old hypertensive male, diagnosed 5 years ago, presents with a gradual onset of constant sticking testicular pain which did not radiate and is of severity 10 out of 10. There was no aggravating or relieving factors and there was associated swelling. Ago, he started experiencing groin pain, hesitancy, dysuria, foul smelling urine, and hematuria. Consequently, he presented to a private practitioner and was given medication for STI, which he claims compliant.
Past medical history: hypertension for 5 years, no diabetes, sickle cell, asthma, liver or renal disease, arthritis, admitted for head trauma 20 years ago at UA Hospital. Drug history: herbal medication, garlic and bush tea for hypertension, takes over-the-counter medication, Panadol and cold medicine, no known drug allergies. Family medical history: mother had hypertension and died at 67, father had bone cancer and died at 52, no other known medical conditions. Social history: lives with partner who is a 40-year-old auxiliary staff worker in a concrete house with 2 bedroom, 1 bathroom, kitchen, indoor plumbing and electricity. Smoke ganja, 6 spliff a day for 30 years, smoke cigarette, 10 a day for 30 years, drinks alcohol at least 3 times a week, and no illicit drug use. Social history continued: plays football every Sunday but has no rigid exercise regimen, feels sad about not being able to go home and work, no health insurance, diet consists of eggs, brown bread, bush tea, saltfish, ackee, dumpling, ground provision, fried chicken, rice and peas, and soda. Sexual history: patient is sexually active and uses protection occasionally, had 2 partners simultaneously but recently only has 1. Significance in the review of system was that the patient complained of shortness of breath and a cough. Summary: a 51-year-old male with hypertension for 5 years presents with a 1-day history of testicular pain and swelling.
Mental status examination. The patient had a normal appearance and there was no abnormal motor behavior, and he was very cooperative. He was relaxed but sad about his diagnosis, and his affect was congruent with his mood. He had normal speech and no perceptual disorders. He also had normal thought content and thought process and was alert and oriented in time, place, and person. His long-term and recent memory are intact, however his short-term memory is affected. His concentration and calculation are also intact, and the patient is unable to read and write, however he is able to draw. His judgment is also intact as well as his insight.